I'm Christina Brown, and welcome back to Our Take. We are talking right now about traveling and the fact that some people are actually factoring in doctor's appointments when they make their travel plans. Joining me live in studio right now is health and wellness blogger Bridget Kwame, as well as social media specialist. I understand that you're actually in town for the Blogging While Brown social media conference.
I am.
Thank you for joining us today. You came in from Canada, is that right?
Yeah, from Toronto, like straight. I just got here like right off the bus.
So you're not here for any medical procedures. You're here solely for the conference.
Exactly. I might have needed some little stress help getting here, but other than that, I'm good.
That might be able to be taken care of at bars.
Exactly.
You may not necessarily need a doctor for that. And joining us live via Skype is Joseph Woodman, joining us from North Carolina. He is the author of Patients Beyond Borders, Everybody's Guide to Affordable World-Class Medical Travel. And Joseph, thank you so much for joining us today. This is a really interesting and fascinating concept to me, the idea that someone decides whether to go to Thailand or Brazil or wherever based on the medical procedure that they need to have done. Just how popular and prevalent is this?
It's a growing market. They're probably growing at around 30%. Most people from the United States travel for cost reasons because the healthcare in the United States has become completely out of control and unaffordable. So many Americans, there's something like 40 million Americans either uninsured or underinsured with Obamacare. That number is going to reduce, but there's still going to be a huge number, many millions of Americans that are one diagnosis away from financial disaster. And so more and more people are traveling. Almost 1 million Americans traveled last year to seek more affordable care outside the United States.
While you were speaking, we actually showed our viewers a map of some of the countries that are very popular when it comes to medical tourism. I understand the top 3 being Costa Rica, Thailand, and Barbados. Joseph, can you explain a little bit as to why people are going to Costa Rica? What procedures are they providing versus, say, Thailand and Barbados?
Well, each destination, there's something like 25 or 30 solid, important medical travel destinations. A country like Costa Rica has its specialty in the areas of dentistry and cosmetic surgery. Again, someone traveling from the United States that wants access to affordable care can save anywhere from 45 to 60% on a restorative dentistry, cosmetic dentistry, and even something as small as fillings or dental crowns and implants. So the main reason is cost, and also because it's much closer. Thailand has great dental facilities, great cosmetic surgery facilities, but it's a long haul for the U.S. patient. If you live in Indonesia, if you're an expatriate living in Cambodia, then it's a lot closer to go to Thailand. But Costa Rica is much better for the short haul U.S. traveling.
And Bridget, you worked with international insurance companies and government health plans that were actually promoting this and making it part of, I guess, the attraction of visiting their respective country. But I understand it's not necessarily just Americans going overseas. There are also foreigners coming to the States to get procedures done.
Exactly. So my background has been in that side where it's more out of necessity. So I worked with health insurance companies and government health bodies, mainly in the Caribbean, where there's some islands where you're even lacking an MRI machine or a specific health, heart specialist. And if a patient is diagnosed with something and needs a treatment or a procedure that's not available in their home island, their health insurance company or their government health body will usually cover them 50, 80, 100%, it depends on the policy, but it will cover them to go to the next nearest place that does have that facility or does have that procedure or that tool. So we worked with, like I said, the Caribbean population who would have to travel mainly to the US, sometimes also up to Canada, depending, for those types of specific treatments. It could be something as simple as flying over for an MRI in Miami and flying back home that afternoon. Or it could be something as complex as needing a kidney transplant and being transferred to Texas, for instance. That was one of our big regions, and staying there for a period of months and then going back home once they're stabilized and could get their rehab or whatever back home. So.
I mean, in some ways, if you have the cash, you don't necessarily need the insurance with something like this.
That's true. That's very true. But it's... With the population I worked with, it wasn't so much about the money. It was really about the need. And my eyes were really open to it during a trip to Bermuda that I went to for a health financing conference, where they unveiled some of their plans to rebuild their main hospital on island. And the reason why they're planning on doing that is because they're spending so much money. The government is spending so much to send people to New York and to Boston areas for treatment. And they're saying, let's have this here so that we can keep the money in-house and we're not spending those exorbitant costs to have people go over to the US. So they're bringing in specialists, they're bringing in US trained doctors, and they're building this kind of state-of-the-art facility in Bermuda so that patients can receive their primary care and any other specialty care there. So it's not so much the money, it's also sometimes what's available and what do I need. And that can be a driving force as well.
Joseph, talk to me a little bit about the price differences. I understand that they can be anywhere from $10,000 to $20,000 when it comes to a procedure that you could get done in the U.S. versus, say, going to Brazil or Costa Rica. We have a list of procedures: spinal fusion, hip replacement, or full facelift. Give me a range. Which country do I want to go to get the procedure done if I don't want to spend as much money as I would spend if I got the procedure done in the U.S.?
Well, it's a little bit more complicated than that, but generally, most of the medical travel destinations that are covered in Patients Beyond Borders allow a patient to save anywhere from 30 to 45 to up to 80 or 90% if you're willing to put up maybe with some of the cultural differences in like India. Most medical travelers seeking, let's say, a hip replacement are going to go to a country where orthopedics is a known specialty of that country. Up until recently, Latin America wasn't really known for orthopedics. So people would go to India, they would go to Thailand, they would go to Malaysia, which is another big value medical travel destination, and you can save anywhere from 60 to 90%, where a hip procedure in the United States is anywhere from $30,000 to $63,000. A hip procedure, it's not unusual at all to go to a top American accredited hospital and get a hip procedure for $9,000 to $12,000. Same thing with spinal surgery, which is a very expensive surgery, and a lot of people have a lot of spinal issues, and this can really be a budget buster for so many people. And Costa Rica, for cosmetic surgery, once again, 30 to 45% savings are not unusual at all for anything ranging from a facelift to a tummy tuck, to even bariatric surgeries, which are very, very popular for people who are interested in weight loss and weight loss programs.
Yeah, those costs are really staggering, and I would imagine that there'll be several questions about the demographics of the types of people that actually go to these medical destinations. And also, are insurance companies subsidizing any of the costs at all?
You know, it's very slow, like everything else in healthcare. Everything moves at a very glacial pace, and there's an entrenched status quo that wants to keep things the way they are in the United States with high costs of care. But yes, more and more international hospitals are coming under insurance programs, whether you're from the UK or from a country like Nigeria or the United States. Blue Cross Blue Shield has a large network. They have different programs, different claims structures, and some of them actually offer medical tourism policies with high deductibles, and then you can put these savings into your health savings account.
And I understand, Joseph, that you also provide recommendations as to where people can go to ensure that the doctor or the hospital that they're going to overseas is accredited. In other words, they don't have to necessarily suffer from buyer's remorse, if you will, for lack of a better phrase.
Well, yeah, I mean, that's why we wrote the book and researched it for almost 2 years. There are thousands and thousands of hospitals and clinics around the world. Healthcare quality has risen dramatically in the last 20 or 30 years, particularly in Asia, more recently in Latin America. And you have something like 500 American accredited hospitals that are accredited by the same agency that accredits U.S. hospitals like Cleveland Clinic and Mayo Clinic.
Well, thank you so much, Joseph Woodman. I'm sorry, I don't mean to cut you off, but I want to thank you very much for your insight. The name of your book is Patients Beyond Borders, Everybody's Guide to Affordable World-Class Medical Travel. Again, thank you for joining us today. And thank you Bridget Kwame, for joining us, coming right in from Canada.
Absolutely.
And thank you, Eunice. It has been fun. It's been a very fast hour, too. It seems like you just got here, right?
I know. I'm just happy to be here. Thank you so much for inviting me. Thank you.
All right. Well, I'm certain that I'll want to have you come back again. And Bridget, please come back again as well. And enjoy the Blogging While Brown conference.
I will. Thank you so much.
All right. I'm Christina Brown, and you are watching Our Take.